Jai Gurudev, Namaskar. I am Dr. Sanjib Kumar Das, working as an associate professor in the Department of Kaya Chikitsa. Kaya Chikitsa is basically focusing on two things. One is preventive care, another is curative care. So when I'll discuss on preventive care, whenever any healthy persons particularly, they are coming, we put them into preventive care. So that's why in my department, I have named it as I treat healthy people in the context of preventive care. So it is very scarcely seen in other medical fraternity that or rarely we can see that any doctors or any hospital which is exactly treating the healthy people. When healthy people are coming to the hospital, we normally focus on their treatment, and people are also urging that, sir, I am healthy, till date I have no problem, I have no issue. I want to be healthy forever. We assess the different criteria described in Ayurveda like Agni, Kosta. Then after assessing, we advise the patient for medicinal purification. After doing purification, we normally advise the patient to take Rasayan therapy. As you know, that Rasayan therapy is nothing but a rejuvenation therapy which will potentiate the patient to be healthy forever. So this is all about the preventive care that we are giving in our hospital, Sri Sri Ayurveda Hospital. We have own pharmacy, and pharmacy manufacturing many Rasayanas, and exactly the Rasayana Amla Churna, one example, and any preparation of Haldi. So these are the medicines we normally advise them to take as a preventive care. Another care we are taking in our hospital, these are the curative care, that all the referred patients come to our hospital. Like if a patient is having spinal canal stenosis, and if the patient is having severe pain since a long time, after getting treatment from different sciences, when patient in extreme condition is advised for operation or spinal surgery, in these extreme conditions, patient normally attends our OPD. So in these cases, we are giving very good treatment. In case we are giving a long period of treatment like 3 to 6 months, and we are giving very nice benefit to the patients. And the basic issue with the spinal canal stenosis patients are that is radiating pain, and that is very intense pain, and it also makes the life of a patient very worst. And if the patient is poor, it is also very painful. Why? Because when the poor patient is advised for the operation cost is too much. So that's why patient normally comes here, and by giving classical treatment to this kind of patients, their pain relieves within a period of 7 to 14 days. And along with it, we just advise the patient to continue the therapy up to 6 months, 3 to 6 months. And in between, we advise the patient to come for the follow-up. Basically, you know that in case of hypothyroidism, many patients are coming with long-term medications. Normally, when patient consults, we have very good medicines. By the medicinal therapy and by purification method, we advise the patient to continue the medicine. Definite course of our medicines, patient get benefit, and thyroid profile becomes normal. And in case of hyperthyroidism particularly, patients are also taking treatment. One patient is there after taking treatment from other sciences for more than 3 to 4 years with ophthalmic goiter patient when consulted me. And in my OPD, I have given only medicinal treatment to the patient. So after taking only 2 to 3 months of medicines, the TSH level becomes normal, along with the ophthalmic goiter, which was very painful for the patient. It is also not found in case of the patient. Patients of diabetes mellitus in initial stage are coming to our hospital, along with different complications of diabetic mellitus are also coming, like diabetic neuropathy, diabetic nephropathy. All the patients are coming, and we are giving very good care to the patients so that patients are taking benefit. Hypertension in Raktagata Bata, and we are giving very good Ayurveda treatment in our OPD. By giving these treatments, the blood pressure of the patient is getting reduced very shortly, and also patient is getting benefited. CKD. So CKD patients are normally due to many complications such as CKD, like hypertensive patient developed CKD, diabetic patient developed CKD. But anyway, in extreme conditions, after taking many treatment from other pathways, when patients are attending in our hospital, so that is the extreme condition. So when patient is advised for the dialysis therapy, after that patient attended our hospital, and patient speaks that I have been advised for the dialysis therapy, sir, what kind of treatment will give in your hospital? So honestly, I would like to speak basic Ayurveda treatment, what described in the classics, we just give like purification therapy, Sankshodhan therapy, or we provide medicinal treatment to the patients. And after a course of our medications, urea level and creatinine levels are getting reduced and patients are also getting benefited. Cancers are coming to our hospital like oral mucosa cancer, mammary gland cancers, pancreatic cancer, stomach cancers. So it was very painful for the patients because by the big hole, what was happening, there was salivation. If patient was taking the water, it was dribbling through the opening part, and also salivation was happening by the opening part, and whatever the diet patient was taking, the diet was coming out by the whole of the right face. So to the particular TED, we have not given any Sankshodhan therapy. Simply, we have given medicines to the patient by taking medicines for 19th day, and which was it was a very satisfactory for the patients, because from other pathies, they have already denied the patient that we cannot close the hole and you have to survive your life by putting a gauze pad over here. And the very interesting thing is that the patient was referred by the modern doctors only. Along with it, we never stop the modern medications. We advise them to take the modern medications. Along with it, when the patient said that even after taking any medicines, the patients are still bedridden, we normally give our medicines, so patients are also getting energetic and they are surviving for a long course of time. And the basic motto of ours is what? To give quality life to the patient. Viral hepatitis. So SGOT, SGPT level increased up to high level. Even SGOT, SGPT level, they are fourfold than that of the normal level. They are also attending our hospital with the complaints of fever, pain in the abdomen, jaundice, loss of appetite, vomiting sensation. So when they are attending our hospital, simply we are giving our Ayurveda treatment to the patients like Dipan Pachan therapy as described in classics. So by taking these medications, the complaint for which they are coming to our hospital, these complaints are relieved within 7 days, and the liver profile which were previously enhanced like bilirubin and also LFT, bilirubin, SGOT, SGPT, alkaline phosphatase, these levels which are previously enhanced in the patient's bloodstream, and we are giving treatment for up to 45 days to the patients. After 45 days, all the blood parameters are getting reduced. Swasthasya swastha rakhanam aturasya vikar prasamnam cha. So that is my motto in the Department of Kaya Chikitsa, and that motto is getting fulfilled by treating patients and satisfying patients. Thank you. Jai Gurudev.